Orthopedic sports medicine focuses on the treatment and prevention of injuries resulting from being athletic or simply active. More exactly, the goal of sports medicine is to maintain the health of joints for a long and active life. Dr. Leon Popovitz, co-founder of New York Bone and Joint Specialists and an expert in arthroscopic surgery of the shoulder and knee, discusses the importance of what he calls preservation.
I call the concept of preservation the key to keeping our joints healthy and young for a long lifetime to come. We're born with only a certain amount of cartilage. We have to do all we can to preserve the integrity and health of that cartilage. Otherwise, it'll wear away much too soon.
Dr. Michael Mizhiritsky, co-founder of New York Bone and Joint Specialists and the specialist in the treatment of the spine, says that diagnosis is the key.
The sooner the problem is diagnosed, the less potential damage occurs. It is very important that anyone with an injury or pain be examined and advised on appropriate testing sooner than later. It is particularly important in younger patients.
Many sports or athletic activities cause sharp pivoting or sharp turns. Injuries may occur to the central ligament inside the knee, which is important for stability. This ligament is called the ACL, or the anterior cruciate ligament. Also, tears in the cushion of the cartilage, called the meniscus, which protects the lining of the bone, which is called the articular cartilage, may tear. When that tears, that causes the joint to lose its protection for that articular cartilage, or that lining of the bone. The longer we preserve the lining of that bone, the articular cartilage that lines that bone, the longer the integrity of that joint lasts.
Preservation is also important in maintaining the health of our spine and nerves.
Buffers between bones in the spine, called discs, may burst and then pinch the nerves. This damage may progress with time. Therefore, it is important to make an accurate and early diagnosis to set up a proper treatment plan.
Dr. Popovitz points out that there are protective structures in all joints that need to be preserved.
All our joints have vital, important structures that maintain the stability of the joint, all the joints. For example, a young athletic lady is involved in some kind of sport or some kind of activity, falls and dislocates her shoulder. The cartilage and ligaments in that joint potentially are now torn. If those cartilage and ligaments stay torn, the joint will continue to be unstable, and the cartilage lining potentially may continue to wear away, and the integrity of that joint is now lost.
New York Bone and Joint Specialists provides expertise from injury prevention education to complex, minimally invasive arthroscopic surgery.